I'm Richard Medlicott. I'm a GP here at Island Bay Medical Centre. We're quite a large practice. We've got about 11,000 patients here on the south coast of Wellington, so it's a pretty busy practice really. So Manage My Health is a web-based patient portal. Think of it as internet banking for your health. Manage My Health is a great way of patients managing their own healthcare online with up-to-date information and ability to message their doctor or nurse. So Frank is a patient who's got a few health issues, and our main use of Manage My Health has been around managing some of his medications.
I regularly have blood tests and he posts the results on Manage My Health, and I get an email to say there's a new message, and bingo, there it is. It's a brilliant platform.
It saves me having to phone them, or the nurse having to phone them, or them having to phone us. I'd rather get a message. I mean, it's easier, it's faster, you don't get caught up with telephone tag back and forth. It automates some of those processes that we have to do. The other thing that it does is enhances the relationship I've got with patients. It doesn't replace that relationship. You need the relationship first. So I wouldn't pretend that this replaces it, it just augments it. I'd get messages every day on Manage My Health, not nearly as many as I do through standard messages coming through from the labs and so on. I probably get 4 or 5 repeat prescriptions a day, 2 or 3 messages from patients a day, to some of which I need to respond to, some of which will just be for my information. It's pretty easy really, and I've got, I think, about 800 or so patients using it, so it's not a big load. I've been Jo's doctor for about 3 years or so, and I introduced her to Manage My Health fairly early on in our relationship.
It could just be as simple as a repeat prescription on some sort of cream or ointment that we've had for Sophia, so I can simply click through to repeats and do that through Manage My Health.
Most of the time patients can't see the information that we write around the consultation, although for some patients we can upload that. For example, more complex patients where you might write it in such a way that they can see your reasoning around changes of medications and so on. From the other end, it's integrated into medtech software, so it means the doctor doesn't have to go to a browser but has messages coming into the provider inbox that they respond to. I think for doctors and practices who are looking to use this, think of it as a way of increasing the efficiency of your business and enhancing the relationship with your patients. So it's a win-win. The cost depends on where you are. Some PHOs and DHBs have funded it, other practices will need to fund it themselves. So the cost for a patient will be variable depending on your practice. So in our practice we don't charge for being enrolled, but we will charge for some services. So for example, an e-consultation out of the blue. It will be variable depending on which practice you're with. Medtech itself doesn't charge the patient to be enrolled into the system. I'd recommend that patients and practices take the plunge and start using it. Plan for it, maybe start off with a few practice champions, open it up to a certain number of patients, and very quickly you'll find your feet and be wanting to open it up further.